with arms overhead, shoulder width apart, and the legs shoulder width apart, we start lengthening the left leg out of the pelvis and back in. Then we worked with the right leg out of the pelvis and coming in, keeping everything flat, so it's just coming out and in. Then we worked with the left arm coming out of the shoulder joint, moving out of the scapula and bringing it back in. And then we worked with the right arm sliding out from the shoulder blade, it's called scapula, and coming back in. We pulled both of them out on exhale, and we brought both of them in, and we pulled both of them out using the rubber bands and bringing them in. And then we worked in a position. When the left arm lengthened, the right leg shortened, and then we went immediately to the opposite side, and the right arm lengthened and the left leg shortened. And there is a place in the lumbar, on the second vertebrae in the lumbar region, where that exchange, that X meets between the right diagonal and the left diagonal. And you should use your exhalation, returning on inhalation, and find the rhythm. First lesson, we looked at the sitting bones, which we ought to sit on. When we sit on the sitting bones, you feel like two little nails that's poking. So we chose to sit on the edge of the chair, and on exhale, we allowed ourselves to roll away from the sitting bones, so we feel like we're kind of slumping, but not go into the slump, just roll away from the top of the sitting bones. And then when we inhale, we pull back in on top of the sitting bones. So we went back and forth with the breath. Then we went forward, allowing the belly to pour over, like you take a soup and you pour the soup, and we're in front of the sitting bones and back. That was just for identification, because we really don't want to go forward with stenosis. We want to go a little bit back to open the vertebrae in the back of the spine. And the way to do it is to imagine like 100 rubber bands that attach to the bone here in the front, and they all come into the center towards the belly button, and they are shortening. We pull the rubber bands and you just roll a little bit off the sitting bones, so the lumbar, the vertebrae where you put your belt, starts widening up. So if I go to the side, you may see it a little bit clearer. So my feet are hip width apart, my feet are clearly on the ground, and on exhale I'm pulling up. It's like zipping up tight jeans, and you should be able to see a lengthening in here and coming up on top. On exhale, pulling up the rubber bands or tightening up, zipping up jeans and up. So hopefully you could see the lengthening and the opening in here. From there, we went into shifting towards one sitting bones, so one comes up, finding back center, shifting to the other sitting bones, coming up, coming back to center. And you do it by pushing the foot into the ground so you can shift the body weight and down. Now I'm going to push my right foot so the right hip can come up.